President Donald Trump's One Big Beautiful Bill is on the House floor awaiting final passage, but several controversial provisions in the bill are giving some Republicans pause. Fox 43's James Corrigan is live with us now to break down what the effects of this bill would be for Pennsylvania. James?
Well, Amy, it would have a broad effect on many different areas, but the biggest areas would be access to medical care and nutritional services. More than 500,000 Pennsylvanians would be projected to lose their health care through the bill, either through medical assistance or health care from the penny marketplace. And local advocates are raising concerns over the effect it would have on the state's most vulnerable residents.
We're asking people to decide whether to pay their rent or put food on the table, pay their medical bill or put food on the table.
Advocates for recipients of SNAP and for area hospitals say this is the choice left by the Senate's version of President Donald Trump's One Big Beautiful Bill. The bill's extension of the 2017 tax cuts and investments of $175 billion in immigration enforcement are widely supported by congressional Republicans. But the bill includes steep cuts to Medicaid and a shift of SNAP costs to states, which Harrisburg Area Food Pantry Executive Director Deidre Lenker says would see the burden on her pantry rise from its normal 1,100 households per month.
Average has been, 60 in a day. We don't have the capacity, the space, the food, the volunteer resources to do a whole lot more.
Pennsylvania's Independent Fiscal Office estimates the cost for the state to increase by $1 billion for SNAP, leading to nearly 144,000 Pennsylvanians losing coverage. It also estimates that up to 310,000 Pennsylvanians would lose their medical assistance coverage through Medicaid. Hospital and Health System Association of Pennsylvania President Nicole Stallings says the change would cut $4.5 billion from Pennsylvania hospitals and that rural hospitals may not survive.
Every hospital is going to feel this cut, but those in particular in rural communities will be most at risk.
The bill's provisions on Medicaid have caused a number of House Republicans to express concern, while the bill's estimated addition of nearly $4 trillion to the national debt have upset other members who have made efforts to reduce deficit spending in the bill. Stallings says her group continues to lobby lawmakers to reject the bill.
It's not too late to reject these harmful cuts and to preserve access to care across the Commonwealth.
Now, two of those congressional members unhappy with the Senate changes are the two local members in our area, Lloyd Smucker and Scott Perry. Congressman Smucker had written a framework for matching spending cuts to tax cuts in the House bill that the Senate did not follow. And Perry's House Freedom Caucus has put out a list of changes they want to see to reduce the deficit in the bill. A final vote could come as early as tonight, but it remains to be seen if Republicans have the votes to pass it. Amy?
All right, and of course, House lawmakers working against that July 4th deadline from the president. All right, thanks, James.